Which of the following is a necessary cofactor for the production of collagen? A. Thiamine. B. Vitamin D. C. Selenium. D. Manganese. The answer is D. Manganese. Manganese, found in oats, brown rice, chickpeas, and spinach, is a cofactor for the enzymes that produce the amino acid proline. Proline is essential for collagen shape and integrity, and is an amino acid, not a cofactor. Other important minerals required for collagen production include copper, zinc, vitamin C, and iron. Which age group has the highest risk for physiological changes due to malnutrition? A. Over 72. B. 12 to 24. C. Over 60. D. 1 to 18. The answer is D. 1 to 18. Children ages 1 to 18 are at the highest risk for physiological changes due to malnutrition. Significant nutritional deficiencies at this age can cause failure to thrive, stunted growth, long-term brain damage, and increased incidence of cardiovascular and metabolic disease later in life. Which of the following minerals must be supplemented in a patient who is on a long-term laxative prescription? A. Calcium and potassium. B. Manganese and selenium. C. Magnesium and chromium. D. Zinc and copper. The answer is A. Calcium and potassium. Prolonged laxative use can lead to hypokalemia and hypocalcemia. This is due to alterations in gastrointestinal absorption and excretion of potassium and calcium. Magnesium can also be depleted during long-term laxative use, but chromium is unlikely to be affected. Zinc, copper, manganese, and selenium are also not generally impacted by normal laxative use. Which of the following foods is highest in vitamin K? A. Sweet potatoes. B. Dark leafy greens. C. Pumpkin. D. Beets. The answer is B. Dark leafy greens. Dark leafy greens such as kale, collard greens, and chard have among the highest levels of vitamin K of any food. The other foods listed, beets, sweet potatoes, and pumpkin all have very low vitamin K content, and are safe for a patient on a warfarin diet. Which of the following foods would be unsafe to consume for a patient taking atorvastatin? A. Orange juice. B. Fish. C. Grapefruit. D. Dark leafy greens. The answer is C. Grapefruit. Grapefruit can decrease the activity of cytochrome P450, one of the body's most important detoxification pathways, by as much as 30%. Consumption of grapefruit while on certain medications, including atorvastatin, can lead to toxic levels of the drug. All other foods listed are safe for patients to consume while taking atorvastatin. Which of the following foods should be avoided in patients who are taking a potassium-sparing diuretic, such as amiloride? A. Tree nuts. B. Alcohol. C. Orange juice. D. Red meat. The answer is C. Orange juice. Patients who are taking potassium-sparing diuretics must be counseled to eat a diet low in potassium. This is due to the fact that consumption of potassium-rich foods, such as orange juice, can lead to dangerously high potassium levels. Excess potassium levels can cause heart arrhythmia and sudden cardiac death. A low potassium diet would be recommended for a patient with which of the following conditions? A. Kidney failure. B. Liver failure. C. Gallstones. D. Diabetic neuropathy. The answer is A. Kidney failure. The kidney is the main route of potassium excretion in the body. During kidney failure, the kidneys are unable to remove excess potassium from the blood. This can lead to hyperkalemia, which can cause nausea, weakness, numbness, arrhythmia, and cardiac arrest.
Allicin, a compound with antibacterial, anti-inflammatory, and antithrombotic properties, is found in which of the following foods? A. Garlic. B. Cold water fish. C. Broccoli. D. Cocoa. The answer is A. Garlic. Allicin is found primarily in garlic, and has a variety of properties that are beneficial to the health. It is antimicrobial, anti-inflammatory, antithrombotic, it can reduce atherosclerosis, decrease blood pressure, and act as a mild antioxidant.
Which of the following is the best source of omega-3 fatty acids? A. Grapeseed oil. B. Wheat germ oil. C. Ground flax seeds. D. Shrimp. The answer is C. Ground flax seeds. Half an ounce of ground flax seeds provides over 130% of the dietary reference intake, DRI, of omega-3 fatty acids. An equivalent serving of shrimp is able to provide 15% of the DRI. Wheat germ oil and grapeseed oil are both good sources of omega-6 fatty acids but are not significant sources of omega-3 fatty acids. Which of the following is thought to reduce pain by depletion of substance P when applied topically? A. Purandin. B. Polypeptide P. C. Capsaicin. D. Curcumin. The answer is C. Capsaicin. Capsaicin, found in cayenne peppers and other species of plants in the genus Capsicum, is used in topical analgesic creams to reduce joint and muscular pain. It is thought to work by depletion of substance P in the sensory nerves.